Welcome back. I'm Dr. Aimee Drescher, clinical psychologist at Bon Secours Mercy Health.
And I'm Dr. Carson Felkel, a child, adolescent, adult psychiatrist and assistant medical director for behavioral health at Bon Secours Mercy Health.
Today, we're going to talk a little bit about what to do when you notice that kiddos are struggling a little bit in the classroom, and what are the signs that we might need to refer on to a mental health professional. So, Carson, what do you think about what are some signs? What are some things that need to happen when teachers and parents who are acting as teachers notice that their kiddos are struggling?
Yeah, thanks, Amy. I'll tell you, as a child, adolescent, adult psychiatrist, the teacher or parent serving as teachers is the most important person in my world. Because they let me know what's happening with the kid. I get to see just a very small slice of the child's life. And this is how I conceptualize it. If the purpose of the heart is to pump blood, the purpose of the brain, one of the purposes, is to create the mind. And because we can't see the brain necessarily unless you have an fMRI scanner, we can only observe the functioning of the mind, and teachers and parents are the ones that get to see that, how a kid learns and interprets information and responds to stress. These observations are just so important. The hard thing with kids is that there's several phenotypes that they tend to default towards, and they can look withdrawn, they could look like they're inattentive, hyperactive, impulsive. They could look like they're irritable. And with all of these different categories, we still don't know what's going on in the brain level that's causing them. So my job is to figure out what is that underlying issue. And I need to partner with teachers to do that. Amy, I know you talk a ton with schools and parents. When do you tell them to refer?
You know, I really help teachers and parents focus on their own stress. So when they notice that their stress around their child or a child in their classroom is increasing, if it's the teacher, I really encourage them to, especially at the elementary level, engage the parents initially to see if maybe they're already connected to a counselor, or if it might be a good time to refer. And then I try to work, with the parent and the teacher, through that process. With the older kiddos, like high school age, sometimes you can really engage them on their own to begin with, or make a referral to the counselor at the school site. So then we can get them additional help. Sometimes, though, it's not entirely necessary to get that additional help yet. I would say that if teachers are seeing in the classroom that their kiddos are struggling a little bit, I like to try and engage the classroom in some self-care, encouraging the teacher to do some things periodically throughout the day, deep breathing exercises with the kids, mindfulness. Yoga is really pretty fantastic. My 6-year-old before COVID in kindergarten did yoga once a week with her classroom, and she would come home and talk about it and practice it, which I do think that when it comes to self-regulation, it's really, a great tool.
Yeah, I agree. Yoga, I think, is the best because it combines stretching and flexibility with the ability to breathe in a contorted position sometimes. And that ability to activate the vagal nerve and the parasympathetic system is like no other. So I love yoga. That's a great recommendation.
Absolutely. And I also always say it never hurts to refer or call and do a consult. And that could be the teacher could call if there's someone on site who they can consult with who's mental health professionals. Some of our schools have folks that are there pretty consistently. Some may have to reach out, beyond the actual school to get some help with that. It never hurts to consult about the child or talk with the parents about getting the parents to do the consult.
So no referral is a bad referral?
No referral is a bad referral.
What do we do about our older teenage population that can come in with some severe emotions?
You know, Carson, we are going to talk about that next time. We really want to spend some time talking about our higher risk population, which generally includes teenagers. I do know that, you know, being within the school district, a lot of the kiddos who are not returning to school at that age group are really struggling. So I'd like to take a little bit more time for us next time to go over that.
That sounds good. Thanks for joining. We'll talk to you next time.
All right.